So today we are going to utilize a technique for releasing the pelvic floor. It's very useful if you have vaginismus, or if you're suffering from chronic pelvic pain or some other condition where you have hypertonicity. So we'll need 2 blankets for this because we're actually going to be laying on the stomach and pressing the knees into the floor. So we'll start with 1 blanket that should be spread like so. So just make sure there's no creases in the blankets, because blanket creases will feel a little uncomfortable under the legs. And the second blanket will give a little bit of extra padding under the knee, because we are going to be pressing, and inside of the knees can be a little bit delicate. So just place the second blanket on top of the first. We'll just start lying on the side, and then bring the leg so that we have about a 90-degree angle in the leg. Actually, I'm going to just take this blanket down a little. Okay, so see there, I have a 90-degree angle in my leg. And then what we're going to try to do is to turn the body so that it rests down flat onto the mat. And when we do this, if the blanket is a little bit high and if you don't have a lot of flexibility in the groin, you may be around here a little bit, and that's okay. We're trying as much as possible to get the hips to come all the way down onto the floor. So just turn as much as you can, and this is the, let's say, the active portion of the stretch. So you want to send your hips down towards the floor. You can kind of turn so that your whole stomach is lying on the floor if that is accessible to you, but relax your groin, relax your backside, relax your leg. Everything is nice and soft. We're going to stay here. You can just, if you want, use a little bit of active pressure on the hip for 1, 2, 3. And then we're going to do a contraction where we try to press the leg into the floor. So you're really activating, pressing into the knee, activating the muscles on the insides of the legs, the adductors. So press 1, 2, 3, and then release. And then we're going to see if we can press in a little with the hip. 1, 2, 3, release. And then relax again. See if you can come a little deeper around. Then again, you can flex the foot as you do this. Press the leg into the floor. So you're trying to press the leg. You're trying to keep the hip and the knee pressing into the floor for 1, 2, 3. And then relax. And then try to just rest in a little bit deeper. You can take it active if you want, just a gentle pressure. Nothing too excessive here. And then relax, and then again we're going to one last time. 1, 2, 3, pressing the leg into the floor, and then relax and see if you can come just a little deeper and just press a little. You feel a very deep opening in the groin as you do this, but don't overdo it. Just allow yourself to get a nice release. And then we're going to come out the same way we came in. So slowly adjust your body so that you come around to the side. And then you can just lay on your back for a moment and just hug that knee in towards the chest. It's quite a deep opening. So you're going to feel, if you just lay the 2 legs, you're going to feel that you're very kind of open on one side and less open on the other side. So we're going to do the position of the opposite side, so as to balance everything. So I'll just up a little for this. So again, lay on your side. Just move this down. And to lay on your side, you're going to take the leg out. You want again a 90-degree angle here, and then try to open the hips around to the side as much as is comfortable. And we're going to do again a little bit of active pressure, so very, very gently pressing on the hip here and relaxing the hip, relaxing the leg. Everything here is soft, and I'm just gently trying to send the hip towards the floor. And then we're going to do the active phase, so pressing into the leg, almost as though I'm trying to close my legs. I'm pressing in around the knee and pressing down on the hip for 1, 2, 3, and then relax. And then again, I'm going to press a little, can take a little bit more of an opening because that's available now after that last round, and then again we're going to actively press, so pressing the leg into the floor as though you're trying to close your legs, so trying to bring the legs together, and then relax, and then again we're going to actively, gently press the hip into the floor, and then take that little bit of extra length if it came, but be mindful, don't overstretch, pay attention, relax here. Now the idea when you take that little bit of extra length, you're not holding tension, you really have to relax through the groin, you have to relax through the inside of the leg, the whole leg is nice and soft. And then we do one last time, so you're going to contract, try to squeeze the legs closed as though you're bringing this leg back to the center, you're pressing into that blanket, and then relax. And then again, we're going to do a little bit of an active stretch, but relax everything as you do your active press, very gently press. And then just take your little bit of length. We're just going to rest here for a little moment, and you're going to come out the same way you came in. So you can gently come around, come to lying on your back, and hug the knee towards the chest. And then we can do a little frog stretch. Now I would suggest using both blankets for this. So now that we have opened the insides of the legs, now this might not be quite wide enough depending on the flexibility. Nope, it's not going to be wide enough. So what I'm going to do is actually just use 2 blankets, one for each leg. So working within your own flexibility, your own range of motion in your hips, but using the blankets for under the knees because it's a little bit softer. So for this, we're going to take both legs at the same time. You want to take them to wherever is comfortable. The knees are at a 45-degree angle, and you want the hips to stay in line with the knees. And we're just going to rest here for a moment. Now this is quite a deep stretch. So after that little opening, you're quite open already. We're just going to rest for a little moment. Try to relax the insides of your legs as much as you can. That's it. And then take the weight into your hands. Gently bring the knees all the way in. You're going to come back into a child's pose. So close the legs for this one. Allow the body to relax down. The hands come forward and the head rests on the floor. And coming all the way back up. So that is our little stretch for releasing the pelvic floor. Now it's quite intense. PNF stretching is active. It's active and contraction. It's a combination of the two, and it can be very intense. So go slowly, take it easy to start. And if you practice this regularly, it can really help to open things up, particularly along the groin and the insides of the legs. And that reaches, of course, all the way into the pelvic floor.